That is not a dumb question at all, especially if you don't work in nursing. So let's talk about it. And thank you for giving me the opportunity to talk about this. So first and foremost, healthcare and hospitals are businesses, and they are absolutely run as a business. Even the nonprofits are run as a for-profit hospital. Like, that's a whole other thing. So this is all about money, right? It's all about how much they can save on the backs of nurses and patients to increase and pad their revenue, their return, So nurses are not only the largest workforce in any single healthcare organization, but they are by far the most expensive workforce in any healthcare organization. And so more nurses equals more costs, right? And nursing is not a billable service. That's another whole separate conversation, because it absolutely needs to be. But it's not. Like, doctors bill for their services. Nursing typically in most places are still rolled into the room rate. Yeah. Don't even get me started. So we cost them a lot of money. And we're like a necessary evil, to be perfectly honest, in their eyes. Like, they hate having to have nurses, but they have to have nurses, right? Catch-22. So why would they fight mandated ratios? Because the mandated ratios are going to dictate that they need, let's say, 10 nurses to staff that unit. Well, prior to that, without anyone forcing them to, they were getting away with only 5 or 6 nurses every shift, right? So you see, that's not only more money per nurse per shift, or per unit per shift rather, but it's more nurses that they have to hire, right? So like more full-time employees and the benefits that go into having full-time, it costs them money, right? And the bottom line is, what is the bare minimum, not even the bare minimum, like what is the very least we can get away with? And we don't care if patients die. Like, that's truly their mindset, that the least amount of nurses we can use to increase our profit margins. That's it. They know that they put patients in highly dangerous situations, because for each extra patient that a nurse has above the recommended ratio for that specialty, the increased rate of death and serious complications go up between 7 and 10% per patient, right? So if a nurse has 2 extra patients, that means that all of those patients have an increased risk of up to 20% of death or serious complication. Like, they know this. Healthcare administrators know this. They don't care. They do not care. And they're never going to do the right thing and staff appropriately. And, oh, by the way, side note, there is no nursing shortage. That's a whole other talk again. More nurses than ever in this country. Plenty of nurses. They just don't want to work in these toxic, unsafe environments. But don't believe that either. They simply want to get away with bare bones at the expense of patient safety, patient lives, and nurses and nursing safety. That's it.